I'm Laura and my first baby's due in a month's time. I've got all my COVID-19 vaccines and the booster.
It can be one of the most nerve-wracking periods of many women's lives, not made any easier, of course, by pandemic. But today, the government is once again urging expectant mothers to get a jab, saying 96% of pregnant women admitted to hospital with COVID symptoms between February and September last year were unvaccinated. Of those, 1 in 5 needed to be delivered preterm in order to recover. 1 in 5 of their babies were looked after in a neonatal unit, and a third required respiratory assistance. And so the evidence in support of vaccination is now clear, but some women are still unsure. A fact public health officials put down to a delay in official guidance. What would your message be as a pregnant woman who's just had the booster and a doctor who's treated pregnant women with COVID? What would your advice be to anyone who's still uncertain?
This year, we can't escape COVID. We've now got 2 years of data about the problems COVID causes in pregnancy, which are real, 1 year of data about the safety of vaccines in pregnancy, and based on all of that data, vaccination is the clearly safest choice and the best way to protect you and your baby against COVID this winter.
Vaccine hesitancy was given a boost this week, with attention cast on Djokovic's lack of one. And on Friday, an unvaccinated consultant told the Health Secretary on a televised press trip that he didn't support mandatory jabs for English NHS staff.
It's not, the science isn't strong enough.
That's your view. And your views?
In response, doctors across the health service launched a campaign called Vaccines Work on social media, hoping to encourage the wavering.
We're talking about a very small minority of people. And actually, we shouldn't all bracket them all together as though they're all uniformly anti-vaxxers. Many are people who simply are not been fully informed, they've got doubts, they need more information, and it's our responsibility to provide that information and to enable them to make an informed decision.
Today, on a tour of a vaccination centre in West London, the Prime Minister defended compulsory jabs for NHS England staff, saying that doing otherwise would put patients at risk.
Perhaps 30% or more are nosocomial infections, so-called iatrogenic. They come in, you're getting infected in hospital. Now, to me, that is just not acceptable. You shouldn't go into hospital and then contract COVID. So it's very important that our NHS staff should be properly protected, should be properly vaccinated, and I certainly encourage that.
Meeting the nervous recipient of a first jab.
Your first dose?
Yeah, I was very scared.
Oh, your first dose?
Yeah.
Well, that's terrific. Thank you for doing that.
Yeah.
He called for anyone still out there who wants one to come forward.
Well, joining me now is Professor Stephen Reischer, who's a behavioural scientist at the University of St Andrews. He's advised both the UK and Scottish governments on their responses to the coronavirus crisis. Professor Reischer, what we've seen in the last few days is a series of events, whether it's that doctor who challenged Sajid Javid or Novak Djokovic in Australia or individual groups of pregnant women saying, well, if you look at my specific circumstances, they might be different to the circumstances we've all been told to just think of as a group, as a mass, for the last year and a half. Is this starting to unravel?
Well, I wouldn't go as far as saying it's unraveling. I think it is really important, as a number of people point out, that there are different groups with different reasons for not being vaccinated. So by far and away, the largest group who aren't vaccinated are what you might call the vaccine indifferent. They're not skeptical, they're not anti-vaccines, they haven't got round to it. In fact, there was a study that came out the other day showing that the further you live from a vaccination site, the less likely you are to be vaccinated. It's a matter of practicality. So the first thing to do is to do the simple practical things, make it easy for people to get vaccinated, bring the vaccines to them rather than wait for them to come to you. Make sure that people can get paid time off to get vaccinated and boosted. And if they're a little bit poorly after the vaccine, as a few people are, pretty mild, but it might mean a day off work again, we need decent sick pay so people can afford to do that. So there are all those practical things. Then there are a larger number of people who are, if you like, they have questions. They're not anti-vax, they haven't decided they're against vaccination, but they have genuine questions. What will the effect be on fertility, for instance? Now, there are very clear answers to those, but the important thing is to listen to people, to listen to their particular questions, to respect them. And if you treat them as fools, or if you treat them negatively, or if you're hostile to them, the danger is you drive them into the hands of the anti-vaxxers, and you reinforce the anti-vaxxers' argument, which is that they don't respect you, they're against you, they're trying to control you rather than trying to help them. So respect and listening and dialogue is the way forward with these people, because everybody's got their individual circumstances. Listen to them and answer them.
What do you think the effect of the Novak Djokovic story will be on vaccine skeptics? Will it buoy them up?
Well, I think the Djokovic story combines all sorts of different elements. I mean, the first thing to be said is there would not be an issue here if he'd got vaccinated. What's more, if it is true that he had COVID in December, then it is equally true that while he knew he had the disease, he attended a ceremony with children, unmasked. He went to a photo shoot unmasked, and so he showed particularly little concern for others getting infected. But to me, the major issue in the Djokovic story is actually the issue of one law for them and another for us. I think that's how the mess started. First of all, people were angry at coming in because they thought he was being treated better than everybody else. And then the government, for political reasons, treated him in many ways more harshly than everybody else. And that's why the judge overturned the decision. It wasn't about the content, it was about the procedure, where he wasn't given the opportunity to mount a case. And I think one of the things that is also coming together in these various stories, the Djokovic story, the story of parties at number 10 and people being invited to parties, is a sense of one law for them and another for us. One of the things that carried us through the pandemic early on was that sense of we're in the same boat, was that sense of everybody having the same situation. And one of the things that is now unraveling is a sense of division, both a sense of division between the authorities and the public, which is toxic and undermines trust, but also divides people. And I think one of the things we need to work very hard to recover is that sense of community, because there is a wealth now of data, studies that come out virtually every day showing that a sense of community, of getting masked, getting vaccinated and so on, not just for yourself, but for others, is absolutely critical.